This video asks questions that nobody else in the pre-OT content universe is asking. Not are your grades ready, not are your hours complete, but are you ready as a human being for what this profession actually requires of you every single day? Because the clinical maturity is not the same as academic maturity, and it is what separates applicants who are ready to go to OT school and applicants that may need a little more time to prepare before they go. For the next few minutes, I want to walk you through the clinical maturity assessment that committees are trying to answer when they read your application. The questions that never appear on any rubric, but that shape admissions decisions quietly and consistently. Clinical human maturity is the ability to be professionally present with human beings at the most vulnerable, intimate, and complex moments of their lives, without making those moments about your own discomfort, your own reaction, or your own need to manage what you are experiencing in that moment. It is the capacity to set yourself aside in service of the person in front of you. That capacity is not taught in the classroom. It is developed through experience, reflection, and deliberate professional formation. And it is what separates applicants who are ready for OT school and the ones that need a little bit more time. So let me be specific about what the profession actually requires, because most pre-OT content describes the inspiring version of OT and skips the full picture of what clinical human maturity is actually built around. Occupational therapists help people bathe, dress, use the toilet, not occasionally, all the time, in almost every setting, because those are activities of daily living. Those activities define dignity. For a person who can no longer perform them without assistance, they are the center of what OT restores. The OT who can be fully professionally present during bathing or dressing tasks is providing one of the most important clinical services in healthcare. The OT who cannot be present without making their own discomfort visible may be causing harm in a moment they should be helping. OT requires professional conversations about adaptive sexuality and intimacy after disability, spinal cord injury, traumatic brain injury, maybe multiple sclerosis. These conditions affect intimate relationships. Clients need a clinician who can address this professionally without making them feel ashamed. That professional presence is, in fact, a clinical skill, and it requires maturity that is only developed through time and experience. And here's what the AP dual credit reality that almost no pre-OT content addresses, because it requires saying something uncomfortable that I'm going to say directly. The expansion of AP and dual enrollment programs are producing applicants that are significantly younger and in many cases less clinically mature than the applicants' programs were designed to train. A student who completes AP coursework in high school and dual enrollment their junior and senior year can arrive to an OT application around 2021 with the prerequisites completed, but without life experience, interpersonal development, and clinical human maturity that graduate professional training assumes you have. That gap shows up in applications, in observation behavior, and in the interview performance. The discomfort with clinical realities, the parent who is still managing the process. None of these are permanent conditions. They're just developmental ones. The issue is not that these applicants cannot be excellent OTs. They can. The issue is, are they applying before they have developed the human readiness that training requires? So here's the honest self-assessment that this course is designed to help you complete, because the honest answers are the most useful, and you'll get them from this video. Have you ever been present with a patient who was undressed or partially undressed in a clinical context? How well did you handle it? Could you assist someone with a bowel or bladder routine professionally without personal discomfort or allowing that discomfort to be visible to the patient? Could you have a clinical conversation about adaptive sexuality with a spinal cord patient or any patient without making anyone feel ashamed about their needs? During your observation hours, were you on your phone? Were you talking to others? Could you receive significant critical feedback about your clinical performance without being emotional or defensive in a way that makes your supervisor responsible for managing your reaction? These are not rhetorical questions. They are questions your fieldwork supervisor may answer before you have your first placement. It's better to answer now, honestly, because you still have time to figure it out. If your honest answers told you that you're ready, that's a great signal. Build your application around that evidence of readiness. If your honest answers revealed gaps, those gaps are specific and addressable. The clinical maturity that OT practice requires is not something you either have or you do not. It is something you develop deliberately through the right experiences. Come join me, learn how to do more in my school community, OT Student Leveled Up, specifically designed for OT students in admissions process, pre-OT students in the admissions process, or if you want to work with me one-on-one with your application in a group environment, you can check out when my groups are offered. The links are in the description. I hope to see you there.